Good afternoon, ladies and gentlemen. We kindly invite all of you to stay in your Zoom schedule for the webinar because the event is going to start. We also recommend to all guests and participants to mute your Zoom's microphone in order to avoid the noise during the webinar. To our honorable guest, Dean Faculty Pharmacy of Universitas Indonesia, Professor Dr. Aryan War Magister Sains Apoteker, the honorable distinguished speakers of the webinar, Apoteker Dita Novianti Sugandi Argadi Reja, Sarjana Sains Apoteker, Magister of Management, Dr. Aaron Courtney, Dr. Nadia Farhana Syafhan, Master of Science Apoteker PhD, and all of the participants of webinar series. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and welcome to webinar series Faculty of Pharmacy Universitas Indonesia with topic Future of Telepharmacy and its Opportunities. My name is Larasati Arum Kusumawardani, lecturer from Faculty Pharmacy Universitas Indonesia, will be your MC and moderator for this event. Ladies and gentlemen, we are delighted to inform you our today's agenda will be first, there will be opening remark from Dean Faculty of Pharmacy Universitas Indonesia. After that, we will have lecture and sharing session by first, Dita Novianti Sugandi Argadi Reja, Sarjana Sains Apoteker, Magister Management. The next agenda, there would be panel lecture session would be given by Dr. Aaron Courtney and Dr. Nadia Farhana Syafhan, Magister Sains Apoteker. And after that, there will be a Q&A session. On the last, after closing, there will be closing and post-test quiz for the audience. Before we start, there are some information for you to know. First, the audience will be able to get certificate from EAE SKP credits if taking the exam with score at least 80% in the post-test. Second, the webinar also can be accessed on YouTube via live streaming, but on the YouTube participant will not be able to get the certificate. Ladies and gentlemen, now I would like to invite Professor Dr. Aryan War Magister Sains Apoteker, Dean Faculty of Pharmacy Universitas Indonesia to deliver the opening remarks. To Professor Dr. Aryan War, please give the speech. The time is yours.
Thank you, Ms. Moderator, Larasati, honorable speakers, Dr. Apoteker, Lucia Rizka Andalusia, M.Pharm, Mars, as General Director of Pharmacy and Medical Device in the Ministry of Health, Dr. Aaron Courtney, Clinical Pharmacy Lecturer from Ulster University, Apoteker Nadia Farhana Syafhan, MSc PhD Lecturer of Faculty of Pharmacy, University of Indonesia, and also from clinical pharmacist from UI Hospital. Today, Faculty of Pharmacy, University of Indonesia proudly present a webinar about future of telepharmacy and its opportunity. Ladies and gentlemen, in Zoom platform, as a pharmacist, we cannot neglect the impact of technology on our services, and also telepharmacy is one of them, and we should prepare ourselves to face with this issue. During this pandemic, 2 years pandemic, the needs of telemedicine also increased because the healthcare provider should restrict the meet with face-to-face with the patient, and also the patient cannot meet directly with the health provider, physician, or also pharmacist. And the telepharmacy has also become increasingly growth. And now with the the lecture from the General Director of Pharmacy and Medical Device, we will know about the regulation about telepharmacy in Indonesia, and also from lecture from Aaron Courtney, a lecturer from Ulster University, we can learn about how telepharmacy practice in abroad. And from Indonesia, Apotheker Nadia Farana Safan will also mention about how telepharmacy practice in our hospital university. I hope you can enjoy this seminar or webinar and learn many things from every lecture, and can bring this experience to your institution, maybe to practice and about telepharmacy, and also to serve the community. Enjoy this seminar. Yeah, I hope it will benefit for you all. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Professor Ari, for the opening speech. Ladies and gentlemen, before we enter the first sharing session, I would like to invite all of the speakers, guests, and audiences to open your video cam in Zoom application for the screenshot for photo documentation. For the committee, please take a photo. Okay, for the first skin, 3, 2, 1, cheese. Okay, and for the second one, 3, 2, 1, cheese. Okay, thank you very much for all the speakers, guests, and also the audiences. So next start, there will be the first session. We would like to invite Apoteker Dita Novianti Sugandi Argadireja, Sarjana Sains Magister Management, the Secretary of General Director of Pharmacy and Medical Devices, Indonesian Ministry of Health, to give the lecture and sharing session for around 45 minutes about pharmaceutical service policies of telepharmacy in Indonesia.
Okay, thank you, Ibu Moderator.
I will read the CV first. So, Apoteker Dita Novianti Sugandi Argadireja, Sarjana Sains, Apoteker Magister Management, obtained her pharmacist profession at Pajajaran University. She then completed her master's at the same campus at the Hospital Management Faculty. Her track record in the world of medicine as a pharmacist started in 1998 as a staff at the Food and Drug Supervisory Agency in Bandung, until finally currently working as Secretary of the Directorate General of Pharmacy and Medical Devices. Apoteker Dita, the screen is yours.
Thank you, Ibu Moderator. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and greetings to all of us. The Honorable and Distinguished Dean of Faculty of Pharmacy, University of Indonesia, all lecturers of the Faculty of Pharmacy, University of Indonesia, the chairpersons of the committee and the entire organizing committee for the Pharmacy Faculty, University of Indonesia, webinar series activity, and the audience of the entire Faculty of Pharmacy, Indonesian pharmacists, pharmacy students, and pharmacist practitioners from Ulster and Malaysia. First of all, I would like to apologize because Madam Director General, Ibu Rizka Andalusia, couldn't attend this meeting and join with us in this webinar because she's in Norway now. So on behalf of her, I will present the presentation. First, I would like to say that I'm very honored to be part of this event. I hope this webinar series can give insight for all pharmacists, pharmacy students, and stakeholders who's participating in this meeting. So in the future, we can improve pharmaceutical services in Indonesia. Allow me to This is the outline of my presentation. We will start with the health situation and challenges in Indonesia, and then we will talk about digital transformation in health, how to implement the telemedicine and telepharmacy in Indonesia, and also we will discuss about challenge in telepharmacy, and the last one is conclusion. In Indonesia, we have lots of opportunity. Sorry, something happened. In this slide, we can describe the health situation in Indonesia and the challenges. Health digitalization is good opportunity to be implemented with a supportive ecosystem, although it's still limited in the use of digital technology. Currently now, there are 202.6 million internet users and also counting in Indonesia, and more than 60% increase in smartphone use, and also more than 44 billion US dollars in Indonesia used as internet in Indonesia. And then with the 60 expected digital healthcare revenue growth in 2022. The current policies are still not based on the data and efficiently services, so that optimization of digitalization is a priority that we must carry on. There are 100 applications that manage the database on individual information. Thousands of health services providers manage individual-based health data, and more than 400 sector government health applications mapped, and many others of the central and regional levels, all of which will be more optimal if we can use this data base for policy making. Now, Indonesia is still experiencing problems in health capacity, where the ratio of the health worker and hospital bed to population is not ideal. In Indonesia, we have a ratio of 0.13, less than 0.4 doctor for 1,000 population, and 1.2 hospital bed for 100 population. So this is a big challenge for us. Now I think Indonesia now it's ready for transformation, for health transformation. For more than 2 years, Indonesia and the whole world have been hit by the COVID-19 pandemic, where this crisis has made us realize that we need to immediately create the transformation in health sector. The pandemic has made us aware of the importance of the reliance of the health sector and points to systemic problems that must be addressed. It is necessary to increase the capacity and resiliency of the health system. 2 years ago, we have a problem to get a mask, we have a problem to get a medicine. So this is why we have to struggle with the resilience in the future. Indonesia's current health system is ready for transformation now, because digital technology is widely available and the public is more open to change. And the pandemic already encouraged us the acceleration of the implementation of digital health transformation to be carried out immediately. And of course, for health transformation, we need a collaboration with all of the relevant stakeholders. And the Ministry of Health will develop a platform to connect various data and systems in the health ecosystem. Distinguished guests, Indonesia has shown that technology is very important in supporting and accelerating the handling of the COVID-19 pandemic. The growth of the digital health ecosystem provides optimism of Indonesia to face the pandemic, especially COVID-19. For example, now government has built the Peduli Lindungi. I think everybody knows Peduli Lindungi because when you check in any place in Jakarta now, you have to use Peduli Lindungi. We built the Peduli Lindungi to support digital tracing of COVID-19 cases that integrated with many other digital applications. Be it from the private sector or across related ministries agencies, the government has also built a telemedicine health services, which are virtual health consultation that can be accessed anytime and anywhere by COVID patients. Through this service, medical personnel can conduct initial screening for patients with moderate or mild symptoms, including the provision of drug tickets through pharmaceutical services facilities appointed by Ministry of Health. So when you get a COVID, but you don't have, but you only have less than moderate, you don't have to go to the health facility. You can use the telemedicine provided by Ministry of Health. This is the stakeholders of our health providers. There are many provided pills, and our system already integrated with another platform, also with the transportation platform, and with another stakeholder. Ladies and gentlemen, pharmaceutical services at the core of the pharmaceutical profession should use digital technology to provide the best services. The presence of information technology open up opportunities in improving the quality of pharmaceutical services. The information technology provides benefit of pharmaceutical services, such as providing fast and accurate information, increased collaboration between health workers, and it also can reduce human error at service point through clinical decision support, and then it can ensure safe administration of medicine. And with the technology, we can fix automation workflow. Along with development of science and technology and the presence of the 5.0 industrial revolution, the use of digital technology has been widely used in the health sector. Nowadays, we know the concept of telehealth, telemedicine, and also telepharmacy. The broad framework for the use of technology in health is called as telehealth, which is why the use of technology in health services such as public health, medical education, non-clinical services. And telemedicine and telepharmacy is a part of the telehealth. And for us in pharmaceutical community, I think telepharmacy is very important, and we can use telepharmacy for counseling, MTM, and also for online consultation. The definition of telepharmacy in pharmaceutical services by pharmacists through the use of telecommunication technology and information systems to patient. For the example, we can use for review of the prescription or medicine preparation and services, and we can also use for drug therapy monitoring, for counseling, for patient consultation, for therapy and monitoring recommendation, and also for management of the chronic diseases treatment. I think it's very important for pharmacists to use digitalization and information system to serve the patient. Several studies related to telepharmacy has shown that the telepharmacy conducting by pharmacists can increase patient satisfaction, increase access to clinical pharmacy services, optimize therapy, and also to increase the efficiency. This is some of the studies that we can find in the literature. In the context of effort to prevent and control the spread of COVID-19 in health clinic facilities, telemedicine services is implemented based on regulation, Ministry of Health number HK 1017 Menkes 4928 44829 in year 2020 concerning guidelines for telemedicine health services during a coronavirus disease pandemic. Health service facility provides telemedicine include hospital, public primary health care, clinic, doctors or dentists and specialists, and also medical laboratory and pharmacies. This one, the definition of electronic prescribing that we can done in an open or closed system, and then there also definition of telepharmacy and how we have to do when we will deliver the medicine. But the electronic prescription until now it exclude the narcotic and psychotropic drug and also injection drug, except for insulin for use because they have to use it by themselves, and also birth control implant. The policies of telepharmacy in Indonesia is follow. Telepharmacy can be carried out by pharmacists and pharmaceutical services facility as follow. First, telepharmacy in the context of telemedicine, according to Ministry of Health regulation, and then the telepharmacy in community pharmacy services based also on Ministry regulation before it fermented. And for the first, we have people in Indonesia like surat edaran, and then the pharmacy, telepharmacy, community pharmacy based on Permenkes. We know that now we already have ESEF or in English electronic pharmacy. And then telepharmacy also include other clinical pharmacy services such as counseling, drug information service, drug therapy monitoring, and etc. Telepharmacy is carried out in accordance with the regulation and refers to the pharmaceutical services service standard. So there is no difference between telepharmacy and conventional pharmaceutical services, that they have to follow the pharmaceutical standards. And then telepharmacy and telemedicine implementation or community pharmacy services can be provided for medicine and medical devices except for narcotic, psychotropic medicine, injection preparation except insulin, and birth control implant as I mentioned before. The Ministry of Health Regulation number 14 of 2021 regulates what we call electronic pharmacy, or in Indonesia PSEF, Penyelenggara Sistem Electronic Pharmacy. This is a new entity, which is a legal entity that provides or manage and operates an electronic pharmacy system for the purpose of pharmaceutical services facilities. They will serve you the information about how to get a medicine. Will facilitate the pharmacy between pharmacies or community, and then the public can access the service provided by pharmacists through PSEF, where PSEF provides information on the choice of pharmacists that can serve. Patient or community have to choose. So they will choose which one the pharmacy they want to get the medicine. And then the pharmacy will prepare medicine according to the prescription and or over-the-counter medicines or limited over-the-counter medicines according to the patient. And pharmacy provides patient drug information to patient, and then pharmacy can use tripartite for delivery. But pharmacy also have to follow the standards. So this is the concept of the electronic pharmacy in Indonesia. Of course, there are challenges when we will implement it, the telepharmacy in Indonesia. There are some of challenges that we have to, to, to fix. The first is we have to prepare the infrastructure or information system in telepharmacy. I think this is not a simple thing, and maybe it will be costly. And then secondly, we have the collaboration with other health professionals, medical doctors and pharmacy, and also another stakeholder. And then we have to deal with the utilization of the data. And the last one, that we have to get acceptance from the public, especially those with low exposure of technology. I think they still need conventional services. And there are some takeaways that we should note, that pharmacy should master the IT skills needed to support the telepharmacy. So maybe we have to move forward, and then we have to learn about the IT skills, because this is important things when we will use the telepharmacy. I think this is the most important, that patient safety is still priority. Telepharmacy should be carried out in accordance with regulation and revert to pharmaceutical service standard. So as I mentioned before, that there is no difference between the conventional services and the telepharmacy. They have to follow the standards. And then the last one, we have to know how to optimization the IT utilization. We have to prepare the necessary infrastructure and also the utilization of the big data. This is my last slide, and for the conclusion, telepharmacy can be implemented as an option in pharmaceutical services while still ensuring and prioritizing the patient safety. So patient safety is the most important thing. And then the implementation of telepharmacy aims to provide public access, effectivity, and efficiency of this services. And it's already proved that in the COVID-19 pandemic, we can use telemedicine, and it's very useful to the patient, and also give a lot of benefit, not only to the patient, but also for health provider. And then telepharmacy must conducted in accordance with the regulation and pharmaceutical services standard. Okay, I think that is all I can deliver today. Hopefully this event can run smoothly and have a positive impact of the transformation of health system in Indonesia towards as healthy Indonesia. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon to you all. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Apoteker Dita, for the sharing session. Now we will continue with participant Q&A session. Since our time is a bit limited, we would invite 3 participants to ask. For the participant who would like to ask questions, please click raise hand in your Zoom application, or you also can ask questions through the chat box. After that, the chosen participants have to mention the name and also the institution where they come from and would be allowed to ask question. Besides that, if you want to ask question in Bahasa, you can also ask it through the chat box in your Zoom apps. So please, if you have any question.
I think this is still a new concept, so maybe we still have to think a lot about it.
Yes, I think so. Maybe before the participant, I would like to have a discussion with Ibu Apoteker Dita. So actually the telepharmacy in COVID-19 is very important, right? But including some surveys, in some surveys I did, some of the patients say that one of the not really good in telepharmacy is they cannot communicate directly with the pharmacist. So sometimes the information that should be given by the pharmacist is missing. So actually, are there any kind of policy that made by the Indonesian Ministry of Health to guarantee that the information that should be given to patients also can be given well? Maybe.
Okay, thank you.
Yeah. Okay.
As we know in PP 51 about pharmaceutical pelayanan kefarmasian, what we call about pharmaceutical services is a direct, what we call direct services. This is we can translate it that pharmacists will have a communication with the patient. So when we use a telepharmacy, we still can use, we still can talk, we still can consultation with the patient, but in the different type. Not only not about we talk face to face, but maybe they can use WhatsApp, or they can use a video call or something. So I think there is no difference between the conventional services and the telepharmacy. That's why we call that in my previous slide that I show you that there must be a communication between the pharmacist and the patient, and we have to follow the regulation that patient safety is number one. So this is the most important thing. But they don't have to face-to-face communication, but they can use maybe written or maybe by SMS or maybe by. So I think it's depend on us. Depends on also the pharmacist. When we try to work harder, so I think the benefit for the patient will be maximum. In the telepharmacy for COVID-19, we also open the consultation with the doctor, not only by chat, but also we can use video call or something. So I think there's no difference between that, but maybe we're still not familiar with that. So we feel that something different.
Thank you, Ibu Gita. So actually it means that even though the telepharmacy service is using technology, as a pharmacist, we still also have responsible to give information to the patients
That's
through
our
any kind of
responsibility.
types of communication. Yeah, I think because that is still important. Okay, thank you, Apoteker Dita. So we have one question from Bapak Muhammad Agus Salim. Okay, Bapak Muhammad Agus Salim. Maybe you can turn on your microphone and ask the question directly to Ibu Apoteker Dita.
You're still mute.
Halo, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you. I want to ask, thank you for time here. What is I want to ask is how to apply telepharmaceutical if access to health in peripheral areas, especially in remote areas.
Thank you. I will try to answer your question. I think telemedicine is a challenge. Yeah? We can use telemedicine everywhere. As long as you get an internet, you can use telemedicine. Maybe you can use telemedicine for consultation or for the patient monitoring therapy and something like that. So I think there is this is a big challenge for us how to use the information technology and the technology of digital to use the telemedicine. If you have a patient in the rural area and you are in the city, as long as your patient get a connection with the internet, so you can give them pharmaceutical services. And how about the medicine? We can use third party or maybe what we call expedition for scan the medicine. I think that will be possible in the next time. So you don't have to go some place which is very rural, but we can use telepharmacy. In Indonesia, Ministry of Communication, I think try to provide internet everywhere, except especially and also for the rural area. That's my question.
Okay. Thank you very much, Ibu Apoteker Dita. So, how about it, Bapak Muhammad Agus Salim? Okay. Okay, so we have our...
May I answer one of the question in the chat box?
Yes, sure.
When will telepharmacy be already implemented in Indonesia? I think it's also implemented in Indonesia now, because in the COVID pandemic, we use telemedicine also, and I think there are a lot of providers now using telemedicine.
Yes, and maybe from Ibu Apoteker Kartika Citra in chat box, Ibu Dita, do hold ministry plan to regulate about pharmacy service standard in telepharmacy, and how about online pharmacy? This is very interesting.
Yeah. As I mentioned before, that we already have a ministerial decree number 14, 2021 about the electronic pharmacy. That is our regulation related to the telepharmacy in Indonesia. So the most important things is there is no difference between the conventional and telepharmacy. We have to concern about patient safety first, and then the other reason we have to follow the pharmaceutical standards.
So is it possible if we only have online pharmacy without physically provide building, or actually the physically provide building should be there?
Until now, we still have to provide the building, because we still follow the standards.
Okay. So it is still one of the important conditions, have a building.
Yeah.
Not online only. Okay.
Yes, because when we handle about the medicine, we need special cases. Yeah, we have to put it in the proper place, and then as we know that we have a drug management system that we have to follow to make sure that our medicines it's still good when it is delivered to the patient. So until now, we still have the pharmaceutical physically, but we can use telepharmacy for deliver the message, for the information, for the consultation, and something like that.
Okay, thank you very much, Apoteker Dita. Maybe this is the last question about the in chat box. It is said on slide about key takeaways pharmacists must be gaining skills in IT. So what kind of skill actually the pharmacists must have?
Yeah, of course, about the technology and information system, I guess. Because if we got tech, we don't know anything about the technology. We cannot use the gadget. We cannot use the computer. I think it's very hard for us to use telemedicine. Maybe you don't have to advance, but you have to know how to use the technology. And also you have to know about the communication skills, because it's there is a difference between face-to-face communication and by digital communication.
Okay. Thank you very much, Ibu Apoteker Dita Novianti, for the sharing session for today. And also thank you very much for the participants who asked the question. Now, I would like to ask Apoteker Dita to stay for a moment, as we would like to present a token of appreciation. So kindly be invited the Dean Faculty of Pharmacy, Universitas Indonesia, Profesor Dr. Aaron Courtney.
Thank you, Prof. Ali.
Yeah, thank you, Apotheker Dita Novianti, for this sharing session about regulation of telepharmacy in Indonesia. I hope it will be the need of telepharmacy in Indonesia will increase, yeah, and better, yeah.
Okay, the certificate will be given to Ibu Apotheker Dita as our honorable speakers. To Ibu Apotheker Dita and Professor Dr. Arya Anwar, please give your best smile for the photo session.
Sorry,
Three.
I'm wearing my mask.
Okay.
I'm in office.
3, 2, 1, cheese. Okay. Thank you very much,
Thank
Ibu
you.
Apotheker
Okay,
Dita,
thank
for
you.
your
Thank you very
time, and
much.
also Professor Dr. Arya Anwar. Okay, ladies and gentlemen, next we would start the panel session. For the first one, we would like to invite Dr. Aaron Courtney to give 45 minutes lecture and sharing session about future and challenges of telepharmacy practice, lesson learned from UK and Ireland. First of all, I would like to read this curriculum vitae. Dr. Aaron Courtney obtained his master from School of Pharmacy, Queen's University, Belfast on 2012. He then completed his PhD from the same campus with title Microneedle Mediated Transdermal Drug Delivery of Biotherapeutic Macromolecules. Currently, he is working as a lecturer in clinical pharmacy, Ulster University, Coleraine campus. He is also involved as an expert member, Pharmacy Research Ethics Committee, B Office for Research Ethics Committee, Northern Ireland. So please welcome Dr. Aaron. Dr. Aaron, the time is yours.
Thank you very much for that very kind introduction, and thank you very much for the invitation to come and speak to you all today. I believe it's afternoon with you. It's currently early morning. It's about 8 o'clock here in the UK, so I'm delighted to be able to join with you. I do have some slides, so I'm just going to try and share screen, so please do let me know if there's any technical issues. Let me see.
Everything is good, Dr. Courtney.
Is that okay? You can see everything. That's great.
Yes.
Thank you. Please do let me know if anything slips off and I can address. So yes, thank you very much for the kind invitation, everyone. I've been asked this morning to come and speak, or this afternoon and speak about the future of telepharmacy and its opportunities. And I'm delighted. I was listening there to Miss Dita Novianti's talk, and I found it very interesting and noticed many of the similarities that are faced in Indonesia and also here in the UK. So a little bit about me. Thank you very much for the kind introduction. I am a lecturer in clinical pharmacy, and I actually work, the connection with your esteemed institution is with through Dr. Delhi Ramadan. I worked with Dr. Delhi Ramadan whenever he was over here in Northern Ireland. I've since moved institution and now work at Ulster University, and I'm primarily responsible for the undergraduate education in the pharmacy program. So I'm course director for the undergraduate pharmacists coming through our degree course. A little bit of background just about me. My background is really in community pharmacy. I undertook my studies in Queen's University in Belfast. I've worked as a locum pharmacist in community for a number of years. I went through my PhD and postdoctoral research studies at Queen's University in Belfast, and I've had a range of activities that I've been involved with. I've worked very closely with industry and development of microneedle technology. It was alluded to at the beginning of the introduction there. And I've also then been involved heavily in the teaching of pharmacy students. Now as a course director in the School of Pharmacy and Pharmaceutical Sciences at Coleraine campus of Ulster University, I'm involved in a range of research activities looking at service implementation in pharmacy, working with the likes of the Commonwealth Pharmaceutical Association on antimicrobial stewardship service implementation. Some of that involves implementation of services using telehealth and telepharmacy. So we can see quite clearly the connection there in terms of hopefully you find this a useful presentation over this next 40-45 minutes or so. As mentioned already, I'm also a pharmacy expert member on the Research Ethics Committee here in Northern Ireland. In the United Kingdom, we have a very strong structure of research ethics committees that are situated throughout the United Kingdom. And they have both lay and expert members sitting on those who review all of the research that will be undertaken that involves patients in the country. And we're very proud of the Research Ethics Committee's processes that we have here in the UK. They're very robust. And I'm delighted to say that I have been involved in those now for a number of years. That does come up later in the slide deck. That is relevant in that some of the future of telehealth and telepharmacy, I think there's a huge ethical implications for how we use data and use information in working with patients and ultimately for patient safety. So that's why I mentioned it at this stage. Just to give you some indications of where I currently work, I'm delighted to say that in Northern Ireland, we have two fantastic university institutions. Northern Ireland, of course, makes up 1/4 of the United Kingdom, and we're located on the island of Ireland, but we're very much part of the United Kingdom. And you can see that on the map on the top left there. We sit right at the very north of the island, and we have some fantastic, beautiful scenery and fantastic countryside that we're able to use and enjoy. So if anyone's interested, please do visit our website, check out the information that's available online. I will share the slide deck with the officials of the talk this morning whenever I'm finished. So all the delegates, please feel free to interact with the slides. Many of the slides have links underneath them for further reading if anyone's interested in where this information has come from. The Coleraine campus, Ulster University, we have 4 campuses in total. Coleraine is one of the main cities in Northern Ireland, and we have the campus that resides up there, and we're delighted to say that we have some fantastic beaches. We have the Giant's Causeway. We have some fantastic parts of the world. So if you're ever coming to the UK or Ireland, you would be very welcome. Please do drop me a message, and we'd be happy to host you in the School of Pharmacy and Pharmaceutical Sciences in Coleraine. So that's a little bit of a brief introduction as to who I am and why I'm here speaking to you. This morning, I've been asked to cover a range of session objectives, looking at definitions of telepharmacy and telemedicine, contribution of pharmacy services in a modern healthcare setting, discuss hopefully some of the opportunities and challenges associated with technology. Obviously, there are huge benefits to be had, and with those benefits come additional challenges that we as healthcare professionals fundamentally have to deal with. I do want to speak a little bit and provide some perspective on telepharmacy and telehealth in the UK and Ireland. And there are some slight distinctions that can be made, but there are many of shared similarities between the two jurisdictions. So hopefully you find that a useful perspective. I found it very interesting listening to Mrs. Dita Novianti previously about the Indonesian perspective. In terms of pharmacist healthcare provision and future challenges, hopefully we'll discuss some elements that pharmacists and the new generation of pharmacy students coming through, the skills and the competencies that they will need to have in place so that they are fully equipped to meet the needs of the workforce whenever they get out into community, hospital, primary or secondary care, wherever it is that they end up. And one of the things that I'm hoping this talk will show you and demonstrate this morning is that telehealth and telepharmacy has really, in the UK and in Ireland in particular, seen some fantastic movements over this last number of years. Now, some of that, as you can understand, has been driven by the COVID-19 pandemic and the requirement to undertake services in a different way so that we can still access patients and still provide healthcare. So I think it's been one of the silver linings of a global pandemic that this has pushed forward some of these technology changes that otherwise probably wouldn't have happened at the same speed and same rate of implementation. Now that in itself has caused some challenges and some barriers in that not everyone is currently where they need to be in terms of skills and competence and ability to deal with this. So this is one of the challenges that universities and healthcare educational sector in the UK are having to deal with to try and upskill and bring on board staff, those who have been working in practice for a great many years, who have that clinical expertise and knowledge so that they are equipped to be able to use this technology in an effective way. So hopefully we're able to cover these session objectives this morning. And of course, if there's questions, an opportunity for questions at the end, I'd be more than happy to cover those at that stage. So first of all, what is telepharmacy? What is it that we're speaking about? I know Ms. Dita Novianti has discussed some of these definitions already, but I wanted just to circle back and look at some of the history of where these terms came from and how they're relevant to current day practice. So the term telepharmacy itself is a form of pharmaceutical care in which pharmacists and patients are not necessarily in the same place, but they can interact using communication technology facilities. Now, that is a very broad, sweeping definition, but if we think of what that means in a practical context, that allows and provides opportunities for pharmacists to interact with a huge number of patients across a range of settings, whether it be geographical settings, rural settings, urban settings, and to be able to improve and provide efficiencies for the current services that are provided. So telepharmacy is defined as the provision of pharmacist care by registered pharmacists and pharmacies through the use of telecommunications to patients located at a distance. And I suppose one of the key things that we're still seeing here is that it is very much provision of care, very much provision by registered professionals, by those who have undergone training, by those who are in positions of trust, by those who are seen as expert in some regard. And as a result, our patient populations are very much still dependent on our pharmacy staff being highly trained and equipped to be able to not only deal with the clinical requirements that those patients have, but also be able to proficiently manage the IT setting in which they are using. And that can be across a range of IT platforms, whether it's a simple telephone call, whether it's using an online service, something even like Zoom, for example, or whether it's something more bespoke algorithms and artificial intelligent networks coming into play. It's very much seen as a subsector of telehealth, telehealth being a term that is relevant for all healthcare professionals, be they medical healthcare professionals, be they nursing, physiotherapy, dentistry, a whole range of healthcare professionals use this term telehealth, and telepharmacy very much sits within that. Here in Northern Ireland and in the UK, we have seen huge progress in the implementation of telepharmacy services in community pharmacy, hospital, in general practice, which are our three core sectors here in Northern Ireland. And of course, bridging that boundary between primary and secondary care, which is ultimately so important. In terms of what we can do with these services, it very much depends on the technology that you have to your disposal. And I think one of the important things to remember here is that these IT services, whether it's closed circuit TV, whether it's the telephone, an online camera, online chat functions, these are technologies that are now very well established in our day-to-day life for very many people. This is something that many people go to work. They interact with these platforms. Many of you, if you're like myself, working in a university institution setting, for example, will do a huge amount of your day-to-day work using a computer setup. And that is something that is very different from even 10, 15 years ago. And I think as a result of that, it has become embedded in the culture of the society. So use of these settings are not necessarily, they do not present fear as much as they used to. But we do have to be mindful that we don't necessarily capture all of the patients when we're using some of these telepharmacy services. And as such, it's very much seen here in the UK and Northern Ireland context as an extension to existing services and not necessarily a direct replacement. And I think that's important as we develop our healthcare systems. When I was looking at some of the history to these terms, I found some very interesting studies back from the early 1950s, which were carried out over in the United States. And I think probably one of the earliest and most famous uses of hospital-based telemedicine was in the mid to late 1950s, when closed-circuit TV, CCTV links were established in a Nebraska psychiatric institute. And this allowed Norfolk State Hospital consultants to undertake counseling sessions and consultations with patients remotely. This provided a degree of safety and security for both parties. And I think this was one of probably the very first times that we see the term telehealth coming into its own. And this study has been publicized quite widely as a result of that. Now, there were a number of issues And hopefully that's one of the elements that we've been able to improve on in the last sort of 60, 70 years that this has been in place. In terms of telepharmacy, one of the key studies was undertaken back in 2000 in North Dakota State University College of Pharmacy, and they identified an issue that local community pharmacies had been lost. These rural sites usually had, these rural villages and towns usually had a range of pharmacists and pharmacies embedded within them, but for a range of reasons, those pharmacies were closing. And so there was a program of remote contact established where you would have this sort of hub and spoke approach where you have a centralized pharmacy team who were able then to reach out to the rural environment. This acted as a legal loophole because at the time you very much needed a pharmacist on site to be able to provide pharmacy services. And this allowed the team to actually provide pharmaceutical services at greater distance without the need of having a pharmacist based in a particular area. So you can see how there are advantages to having that. Now, we will come on to some of the challenges that are associated with that. It's not necessarily a one-way street and an entirely free way of doing things. And as such, I think it's important that we keep in mind not only the benefits that we are able to provide for our patients, but also some of the challenges and the risks to patient safety that might come with this. And both of those studies have been publicized quite readily. So you can go online and search for those. And I think there are some links in the bottom of the slide deck if anybody's interested. So in terms of the benefits, it improves access to medicines and healthcare for some populations. And I use this term some populations because with telecommunication devices, you're not always going to be able to reach every individual. If you think even of, for the younger generation amongst us, if you think of your online presence in the social media platforms, for example, not everyone is on every single social media platform. Some people will tend towards the likes of Twitter. Some people will remain on Facebook. Some people will have TikTok, for example. There's a whole range of these online platforms and people will gravitate to different platforms. And so simply providing a service on one platform is by no means a guarantee that you're going to access the entire population. And I think it's important that we keep in mind some of the potential for health inequalities here if we are moving towards the telepharmacy, telehealth provision, which of course can provide those benefits, but we also need to be mindful of who might be disadvantaged. So for example, perhaps elderly generations, those who are maybe not as IT literate as those coming through at the moment. I'll give you an example. I myself, I'm 32. I consider myself still very young, fit and healthy and reasonably IT literate. But if I go to give you an example of my parents or even my grandparents, for example, they are not as intuitively keen to go online and search things and use online services. They are much more keen for face-to-face option. I contrast that with my 3-year-old son, who is up running about and very, very active, who already knows to lift an iPad or a tablet and knows to swipe, knows to scroll up and down, can search for his favorite programs. It's a very different range of skills and activities that you have, and that's within 2 generations of people. So we always need to be mindful of those who are unlikely or less likely to engage in some of these services. In addition to that, it's not just an age issue. We also see people from socioeconomic backgrounds who are maybe not as affluent, low and middle income settings, for example, and that can be across a range of countries. Here in Northern Ireland, we have areas of social deprivation, and we would find that even in a very local context, driving 10, 15 miles between two parts of Northern Ireland can get you very different levels of socioeconomic activity, and as a result, the access to some of the IT services that would be required can be limited. Key things to remember here is that qualified healthcare professionals can provide these services other than the dispensing model. Here in Northern Ireland and the UK, pharmacy services have become a huge element of the provision of healthcare from pharmacists, and we've moved away from the sole process of a dispensing service. We very much see pharmacists involved in primary settings, secondary care, in medicines reconciliation, medicines review, medicines optimization processes. having consultations, clinical examinations, prescribing. We have a range of activities of which telepharmacy can play a role in each of those. So in spite of the role of the pharmacist at first level healthcare points, there is an uneven distribution of these structures, and it is noticeable in low and middle income settings in particular. Shortages and therefore distribution at regional level across urban and rural areas also cause problems. So this is something that I think we need to be mindful of as we move through the development of these technologies that will be ultimately embedded within our health systems. So to give you some examples of telepharmacy services that we see here in the UK, and again, a lot of this has been advanced significantly by the COVID-19 pandemic. We very much had national and regional plans, a sort of 5 to 10 year strategy to implement a lot of this telehealth and telepharmacy within our network. But as a result of COVID-19, this was fast-tracked quite readily over this last number of years. So some areas of healthcare are still only getting to grips with this, and some areas of healthcare are very much further along the road. So in terms of medication selection, we see the implementation of automation and algorithmic decision-making, and these are based on our local and national guidelines, which come from NICE, the National Institute for Care and Health Excellence, and also from local, for example, in antimicrobial stewardship processes. When you're selecting antibiotics for individual patients, we will use the likes of flowcharts and algorithms to support diagnosticians and clinicians to make decisions that are in line with our antimicrobial stewardship techniques. And we can see that some of this is actually automated on apps. For example, there's a BNF app, which is the British National Formulary. And if you click into it, you will be able to see through how which medicines are most appropriate, and therefore helping as a diagnostic clinicianal tool for those who are involved in the care of patients. Already, we have across Northern Ireland and the UK order review and dispensing automated programs. These are bots that you ring in, for example, telepharmacy. You make a phone call, you can record, you can leave your messages, and someone at the end, or indeed an algorithm, can organize the repeat medication to be dispensed, ready for then either pickup face-to-face setting in the pharmacy or for delivery from the local pharmacy. Patient counselling, we have seen, for example, with the COVID-19 pandemic, the implementation of a fact-checking line and an opportunity for patients to go online, either in a video conference call such as this, or indeed using the telephone to have access to clinicians very readily. And this has improved access greatly, and also helped to reduce and to combat the spread of misinformation, particularly around the likes of COVID-19, and to allow patients, everyday patients, to access the high quality healthcare evidence base that is available. In terms of patient monitoring, we can also have consultations online, basic and clinical examinations. These would happen over the phone in pharmacy settings, for example, very much so in our general practice with our medical colleagues. They would do this quite readily now, where patients would take photographs of, if it's a skin condition, they would take a photograph, send that into their GP or send them into their pharmacist, and they can then review that, follow up with a telephone consultation, and make recommendations off the back of that. One of the potential issues with this is the loss of incidental findings. And what I mean there is, in that face-to-face contact with patients, if you're not having that contact, you lose a certain degree of capacity to make a full and holistic clinical assessment of the patient. And you have a tendency more to focus on the actual problem, the condition that the patient is presenting with. And sometimes that can lead to misdiagnoses or indeed missed incidental findings of importance, simply because you don't have access to all of the information that you need to. And I think some of the recommendations that our regulators are coming through with are indicating that really we need to improve how we are dealing with patients in those consultation settings. So you can see there we're also providing medicines reconciliations, optimizations, and of course health promotions. This is happening in secondary care as well as primary care. So we see this also in hospital settings, many diabetic clinics, asthma clinics, pregnancy clinics, for example. Antenatal care is now provided with some degree of online contact with, we see, for example, breastfeeding tutorials and webinars running so that patients can dial into these. With events like this, for example, you have the opportunity to record, and therefore patients can then look at that and review that in their own time. So it gives a degree of flexibility in the provision of healthcare, that they're not having to take time off work, for example, or perhaps missing appointments because they're simply not able to attend. We see here that telepharmacy, telehealth, and e-health is very much an interconnected world. And I don't want to veer too wildly across boundaries here, because I think it's important that we stay on topic. But it's very difficult to mention any telehealth, telemedicine without talking a little bit about the increase in wearable technologies and e-health. And what we mean by that are all of these devices that now monitor your heart rate, monitor your step count, monitor your fasting glucose levels. All of these different devices that are now available, patients are presenting to community pharmacies, presenting to hospitals with more and more data, and in some cases, quite substantial amounts of data that they're then asking for comment on from their healthcare professionals. And I think this is something that we're seeing an increase in, with patients becoming more self-aware and patients becoming more in tune with their own health status, which is only a benefit. But as a result of that, we need healthcare professionals who are able to deal with the demands that come with managing larger amounts of data, identifying trends, identifying health and heart conditions, for example, and cardiovascular, and whether it's changes in heart rate, breathing rate, blood pressure. Each of these come with additional challenges in terms of how patients are to be monitored and to be assisted in their healthcare. So I have a few questions just as we're going through this sort of halfway point in the discussion. I want you to have a think about, can you think of any areas of positivity, any areas of challenge that you see in terms of this health? Is this widely established in your area currently, or do you think we currently have the right skills mix to implement some of these areas of this type of healthcare provision? So I'll just let that sit with you for a minute, and hopefully as we go through the next few slides, we'll be able to identify some of those areas. So in terms of the benefits of telepharmacy, this very much depends on the sector in which you're in. But if you look at the academic literature to date, you will see that there is a possibility for any of the following that's on screen: increased income, flexibility with attendance, potential for better engagement for patients, work-life balance for staff, better satisfaction all around, and fewer missed appointments. Now, each of these benefits come with some additional problems, some challenges, and I think it's important that we're mindful of that. But I think it's good to see that we recognize there are benefits to be had here, and that should be capitalized on. We can see a range of studies that have shown this on a grand scale. So for example, in Canada, there was a study of 47 cancer patients in Alberta, and they were saved a collective total of 27,000 miles of travel, simply because of the telepharmacy services that were implemented. And that was a study carried out back in 2012. You can see in 2018 that medication errors were reduced. Again, 6 rural hospitals showed that with telepharmacy, 19% of patients had 1 or more medication errors that were picked up by remote pharmacists. So there is an extra layer of provision of protection and hopefully risk reduction. Here in the UK, we have an opportunity for increased provision. A recent white paper, which is one of the lowest forms of recommendation to government that can be made, has recently been published, and it identifies that telehealth consultations obviated the need for 56% of GP appointments in community settings and around about 3% of appointments in hospital settings. That leads to an equivalent of about an annual saving of £7.5 billion. These are huge savings that we can potentially achieve here. You can see that there's opportunities for pre-triage through app technology, adoption of the technology in the private sector. So here in the UK, we have a very strong public sector NHS healthcare provision service. but that is supplemented. There is a private healthcare service that is also available here in the UK, and patients will sometimes opt to go private for certain procedures or certain conditions. And we can see that that technology is very much trying to be adopted across both settings. You can see some of the cost predictions. Now, these are only predictions, so I would always take them with a pinch of salt. But you can see here some rather large numbers in terms of the savings that could be saved in NHS GPs, walk-ins, and importantly there in pharmacy services. The number of appointments obviated per month there is upwards of 250,000, and that's across the UK. Now, interestingly, here in the UK, patients can walk into a pharmacy at any stage, free of charge, and get advice and guidance from their pharmacy. That is something that our pharmacy services are very proud of, that we provide that service, but obviously there's always a call for increased funding to allow pharmacists to be remunerated appropriately for the advice and the services that they do. I should say this table on screen is really looking at access through telehealth services, which would be a free at point of use option for patients. In terms of a global context, if you look at the Federation of International Pharmacy, they state that the USA have most in place in terms of telehealth and telepharmacy. In Europe, our not too distant neighbours in Denmark, they have something like 430 pharmacies that serve 5.5 million inhabitants, and most of these pharmacies offer online sales. Here in the UK, not every pharmacy will offer an online service, but very many pharmacies are beginning to implement this as they see this as a way of accessing patients and bringing patients to them. Now, one of the questions that I think came up in the previous discussion was looking at, can this be a solely online venture, or do you still need to have a presence, a physical presence? And there are online services solely focused for pharmacy services here in the UK. But the vast majority of the population still expect to be able to walk into a physical shop presence, a physical pharmacy, to get that advice should they need it. So I've mentioned now hopefully some of the positive elements of the tech and telepharmacy. In terms of the challenges, there was a Federation of International Pharmacy report that came out and identified a range of issues in terms of the implementation, the infrastructure needed to ensure that we have appropriate provision and care, the personnel, so the staff who are appropriately trained, who have the appropriate time and resources to manage this, patients who understand the systems and know how to operate and to access, and of course, data management. So one of the key areas of online and telepharmacy here in the UK circles around the requirement for good data management and what that means in practice. Currently, we see a lack of regulation and standards. That is changing, but it is not changed yet here in the UK, and I'll talk a little bit about that. There is an increased burden on already pressurized staff. So amid the COVID-19 pandemic, pharmacy staff have been under huge, tremendous pressures to deliver the services that they can, and simply adding in additional services is coming with additional burdens. And some settings simply don't have the workforce capacity to engage with that. And of course, if you are implementing new technologies, new setups, it's always going to come with a financial cost. In terms of some of the key challenges, and I think this is where some of my time sitting on the Research Ethics Committee has maybe exposed me to this ahead of the rest of my peers and colleagues, for example. There are a range of societal factors in terms of normalizing use of technology. And again, this is something that is very well established, but it is not universal and it is not fully across all areas of the population. Think of patients, for example, who have a range of physical or mental disabilities, patients who are blind, patients who are deaf, for example. Some of these technologies can actually assist, but unless they're designed in a universal way to incorporate and to include patients with disabilities, they can often act as a barrier. So we would see, for example, interpretation services for British Sign Language users. So those from the deaf community, for example, would use technology that we have a three-way consultation with a clinician, a patient, and an interpreter, for example. Ethical challenges in terms of a consumer versus a patient. So who owns and who is responsible for the data? The rise of health companies. So with data access and data management come companies who will be managing all of this, providing good services, providing opportunities. But of course, with that, they get access to huge areas of data that they maybe previously didn't have before. And this is something that in the research ethics committees, we're always looking at to ensure that researchers and companies are mindful of this and they're taking on board recommendations for data security and use of data in an appropriate way. But of course, there are always going to be individuals who are acting inappropriately, and that's something we need to be very mindful of. Increased connected health solutions, predictive, preemptive, and personalized. It all sounds very positive, but at the end of the day, not everybody wants to know every piece of information about themselves and their healthcare. We have patients reporting with this increased e-health and knowledge of their current fitness level and their current health status comes anxiety problems in terms of managing that. Diagnoses, genomic diagnoses, and what that might implicate further down the line in 20 or 30 years' time for that patient can have a drastic impact on how that patient views their own existence and how they live their lives. So these very small, minor improvements in health provision do come with some very fundamental questions over how we manage this and what our role as healthcare professionals are. In the UK and in Europe, we have recently, in the last, I think it was 2016 and 2018, we had the GDPR, the General Data Protection Regulations took force, and that was across Europe. And they are in place in the UK. And these are a very strict set of robust laws and regulations to ensure that people are managing data appropriately and only accessing data when they have a genuine need to do so. And this was to limit some of the spread and the misuse of data that had been going on between some companies in the past. But these GDPR regulations are universal in terms of they affect every aspect of healthcare, of education in the UK and wider. And of course, in genomics, there are potentials for screening, issues here, and certainly the cost and the provision, whether that is everyone in the population having access to that, whether that's appropriate. So these are some of the challenges that have to be managed. A recent publication identified in the UK some key challenges for telehealth and telepharmacy. So for example, multidisciplinary team working, big data, self-management, personalized care, evidence and knowledge, population data, do you share, do you not share? There's a huge amount of information here in terms of what our healthcare professionals are now expected to deal with. And these are some of the core issues that we're trying to identify or to work on and to improve on over the next 5 to 10 years so that our health sectors are at an appropriate operating level. In terms of barriers to progress, it was a great publication. This is from a recently published textbook on telemedicine that identified 7 deadly barriers for telemedicine. And I think these directly apply to telepharmacy, many of which we've covered already. But I think it's important to note that the financial implications, the regulation that's associated with this hype, which when I look at that, what they're talking about there is we need to be honest with ourselves in terms of what is working and what does not work. Just because we have a tele version of something doesn't necessarily mean it is better than the existing processes that are in place. And I think it's important that we are honest and look at the evidence base and we look at the studies to show, is there a benefit being had here? We make sure that we run and develop studies that are assessing this, which links in with point 6, a lack of evidence to support. So you can see here that there are a range of potential barriers to progression, but hopefully we're in a position to overcome those. I would like to talk very briefly about the UK and Ireland perspective. Specifically, when I talk about the UK, you can see over on the right-hand side a map. This is the UK and Ireland. The United Kingdom is highlighted in blue, and we reside here over in the top tip of Northern Ireland. And you can see in white here then the rest of Ireland. So in the UK, we currently do have regulation for telehealth and telepharmacy. They are regulated by the individual regulators, whether it's the General Pharmaceutical Council, the General Medical Council, and I believe the British Medical Association have also issued guidance on this. We are expecting additional regulation coming through in the next couple of years, whether it's for doctors in general practice, whether it's for prescriptions that can be ordered via apps, for example, whether it's in dentistry. Huge changes to how dentistry provision has been used here in Northern Ireland and the UK throughout the COVID pandemic, and of course psychological support services, the likes of telephone and video counselling, has been currently provided to patients and is currently provided to patients, but that is something that we're expecting additional regulation to come through in the next 6 months to a year. In the UK, we have the National Health Service, which is free at the point of use. It is paid for through taxation and other mechanisms, but it is free at the point of use. And throughout the COVID-19 pandemic, telehealth vastly increased. There was existing structures. The Technology-Enabled Care Services Resource for Commissioner was developed back in 2015, and it supported the implementation of safe technology across the entire health network. And that still remains in place. That is still a key focus, but that was hugely accelerated during the COVID-19 pandemic. We've spoken briefly about GDPR regulations, big health data, biometrics, and access to data, and companies and healthcare providers being transparent, accountable, and considering the context in which you're operating in, reflecting on the impact of an artificial intelligence system on individuals affected, as well as wider society. So there are some big questions here for healthcare providers to ask themselves in terms of how they are providing a healthcare system, not only for the individual patient, but also for wider society. At the moment here in the UK, the MHRA, the Medicines Health and Regulatory Authority, they regulate any apps and algorithms that are used as they are seen as medical devices and therefore fall under the Medical Devices Regulations of 2002. And as such, if you're involved in developing online platforms, the prescription apps, for example, all of those have to be regulated by our MHRA. So there is quite robust regulation already in place in the UK. In Ireland, again, slightly different jurisdiction, and I'll draw your attention, it's to the white portion of the map. This is what we're talking about. There is no explicit regulation in place, and currently there is a lack of legislation. So you can see even two countries sitting side by side can have very different outlooks on this. At the moment, the provision of telepharmacy and telehealth is covered by General Health Service legislation, which is the Health Act of 2004 and 2007. And this is where healthcare professionals are regulated by independent regulators, and the health service executive have operational responsibility for provision of healthcare, and that includes telehealth. But there is no specific legislation for telehealth or pharmacy in Ireland. And again, we can see that there's an increase in use of Microsoft Teams, Skype for Business, WhatsApp, Cisco WebEx, a whole range of facilities that came into place. Ireland are expecting some increases in the legislation front. At the moment, they do provide clinics using video conferencing. Pharmacy services do operate online and through the use of telepharmacy. And you can see here a list of recommendations that will be transferred into law in the coming years. And just to finish up, just before we come to take the session to a close, I thought it was important to take you through some of the plans that we have from a university context in terms of the education of our undergraduate students coming through in the next sort of 5 to 10 years and what we hope to achieve. Here in Northern Ireland, there was a local workforce review, which was taken hand in hand with what the Federation of International Pharmacy undertook, which was a global workforce review, identifying the 13 key challenges. And you can see that many of the pharmacy workforce review issues that we face here in Northern Ireland actually line up quite readily with what the Federation of International Pharmacy have identified. And as a result of that, we have made some quite drastic changes to how our pharmacists are going to be taught over the incoming years. What we will be moving to is a model of 4 years undergraduate education, followed by foundation training year, followed by registration assessment, whereby a pharmacist can become registered as a pharmacist in the UK, and then move on to advanced practice right through to consultant level. So we have a number of consultant pharmacist positions. Those are protected terms here in the UK. I think in Northern Ireland we have, three, grand total of three consultant pharmacists. But this is a post that is very much sitting aligned with consultant medical staff in terms of provision of care to clinics, advising and training other staff members, and being involved in research and education for the next generations of pharmacists coming through. So we can see a huge increase in the way that we are providing these services to our students. We have a complete overhaul of the undergraduate curriculum, and as part of that, we are implementing a range of prescribing, consultation skills, clinical assessment and examination skills that we currently do touch on, but we'll be doing in much more detail and depth. And with those, we will be implementing telepharmacy services equivalents. So we will be involving students in learning how to prescribe remotely, how to undertake consultations online, for example, how to undertake consultations over the telephone. And we have brought equipment and technology into the School of Pharmacy to facilitate us to do that on a much larger scale than what we currently can do. This also aligns with the Royal Pharmaceutical Society Advanced Pharmacy Framework, in which pharmacists are also going to be expected to be involved in role modeling, mentorship, education and training of other staff members. So at the moment, when you register as a pharmacist, you can very much just continue as a working pharmacist without any real concern of your colleagues or how they are progressing. What we're moving to as a profession here in the UK is that we have education and research embedded within the profession so that everyone has a responsibility for the improvement of standards, no matter what sector or area that you would be working in. And I just want to circle back to this white paper before we finish. I think it's clear from the report that pharmacy services simultaneously can enhance outcomes for patients. It's important that we get the skills mix right, that we have quality training, that we have undergraduate, postgraduate setting opportunities for those who are undertaking that training, whether it's at a university setting, whether it's in practice, robust systems for safe and secure management of patient data, and interprofessional collaboration so that our healthcare professionals, our pharmacists, our doctors, our nurses, our dentists, that everyone is aware of what roles and responsibilities they have, and we're in a much stronger skills mixed position in terms of a healthcare system opportunity. So just to conclude, thank you very much for your time and attention. Hopefully by the end of that session, you're now in a position to define telepharmacy, telemedicine, to consider some of the benefits and opportunities and challenges associated with technology, specifically from the UK and Ireland context. And then we finished with a little bit of information about our experience in education in terms of telepharmacy here in the UK. Thank you very much for your time. Thank you for the organisers for inviting me. And if there is an opportunity for questions now, I'd be more than happy to answer those. Thank you.
Okay, thank you very much, Dr. Courtney, for the sharing session. So the question and answer session will be at the last after our second speakers. So for the participant who has question, the question and answer would be open after our second panel speaker, which is Ibu Dr. Apoteker Nadia Farhana. Next, we would like to invite our second speaker for the panel session, Dr. Apoteker Nadia Farhana Syafhan, PhD, to give 45 minutes lecture and sharing session about the telepharmacy practice in hospital. I would like to introduce her first. Dr. Nadia Farhana Syafhan, Magister Science PhD, obtained her master from Faculty of Mathematics and Natural Science, Department of Pharmacy, Universitas Indonesia. She then completed her PhD program at School of Pharmacy, the Queen's University of Belfast, United Kingdom. Currently, she's working as a lecturer and become a head of clinical pharmacy and social pharmacy laboratory at Universitas Indonesia. She is also active as a pharmacist and become a coordinator of an inpatient pharmacy at Universitas Indonesia Hospital. So please welcome Dr. Apoteker Nadia Farhana Syafan. Ibu Nadia, the time is yours.
Thank you very much, Apoteker Laras, for a very nice introduction. Honorable Dean of Faculty of Pharmacy, Universitas Indonesia, Professor Ari Yanwar, distinguished speakers, Ibu Dita Novianti, Dr. Aaron Courtney, all professors, academic staffs of Faculty of Pharmacy, Universitas Indonesia, pharmacy students, and all pharmacists, participants of this webinar. Very good afternoon. I'm very honored to be part of this webinar on the same screen with amazing people like Mrs. Dita Novianti and of course, Dr. Aaron Courtney. So I've met Dr. Aaron Courtney when I was studying in Queen's University Belfast. So please allow me to share about the telepharmacy practices in hospital. So here, I'm representing Faculty of Pharmacy as well as Universitas Indonesia Hospital. So before I start with the outline and so on, so I would like to just give a picture of Universitas Indonesia Hospital, which is located in Universitas Indonesia campus in Depok, West Java, Indonesia. So this hospital has probably more than 30 pharmacists who deliver pharmaceutical care, but I will not talk about this hospital more because I would like to invite you to visit our website here. Okay, so here is the outline. So probably within 45 minutes, I will talk about the background of telepharmacy practices in hospital, followed by example of telepharmacy practices in hospital. Probably I could not only share about the what Universitas Indonesia Hospital done until now, but I need to collect as well from other countries about the telepharmacy practices in their hospital. And then I will talk about the issues or challenges, followed by a future of telepharmacy practices in hospital. So as we know, in relation to COVID-19 pandemic, hospital is not only the primary battlefield for pandemic prevention and treatment, but also a high risk place for transmission of infection. But we know that the risk of cross-infection in the hospital can be minimized by reducing hospital visits, reducing exposure opportunities, as well as utilizing strategies adopted during the pandemic of various infectious diseases. One of the strategy adopted during the pandemic of various infectious disease. Next, please. So telepharmacy. So here, the definition has already been mentioned by Dr. Aaron Courtney and Ibu Dita Novianti as well. So I will not talk about the definition again, but we know that our regulation allows more patients to receive care and more providers to deliver care. Yeah, so, but why telepharmacy? Because there are reasons of providing telepharmacy services in a hospital. So no matter the challenges, how hard the difficulties we face, maintaining quality of care, including pharmaceutical care, is mandatory. So we have to involve the best personnel for verification, for evaluation and dispensing of medication, namely pharmacists. Even though the pharmacist should work remotely, but we need to involve this health professional to maintain the pharmaceutical care quality. And then it is inevitable that we face situations where the number of pharmacists or pharmacy technicians who can be on site the hospital were very limited. However, we cannot burn out the pharmacists we have while recruitment of hospital pharmacists is lagging. So telepharmacy is a feasible option for easing pharmacist shortages, especially for emergency, after hours, weekend, vacation, or sick leave, or even like professional meeting. And then the next reason is to improve the hospital pharmacist's life. Actually, Aaron has mentioned about the work-life balance. So here, the telepharmacy is hoped to improve or to reduce stress of hospital pharmacists because of their heavy workload. And then probably pharmacy or pharmacy technician or a junior pharmacy will be feeling more confident to perform their work since the telepharmacy supervise their work remotely. Yeah. Okay. And then since pharmacy department plays important role to hospitals' income, so telepharmacy pretty much could maintain the bottom line of hospital. And we know that telepharmacists may cost less than an on-site pharmacist. Okay, and then the last one is about the complying regulation. We know that Indonesia has stringent guidelines emphasizing the involvement of pharmacists in prescription review and also the dispensing the medication. And there's a possible restriction of access of the non-pharmacy personnel. So, these are the reasons of providing telepharmacy services in the hospital. Okay, so the target of telepharmacy services in the hospitals are not only inpatients, but also outpatients, emergency department patient, as well as society. Yeah, so here I tried my best to collect some of examples from other countries' hospital who provide the telepharmacy services. So the first one is about medication reconciliation and medication history taking. So we have example from US hospital where they use the secure messaging medication reconciliation tool with a patient portal. So the patient could access some website called My Health EFAT. So this is like a patient portal in a hospital, in a US hospital. And then they were asked to fill the form like this. And then the hospital pharmacist will monitor or will check and then we'll make sure that the patient complete all the questions in the form. Okay, and next we have example also in the emergency department in US hospital. So the medication reconciliation and medication history taken were performed using the mobile charts combined with video conferencing for collection of medication history. So this is actually pretty much the same with the previous slide where the patient fill the form SMRRT like that. So and then the pharmacist make sure that all the questions were filled or were answered. So the outcome of this practice is resource optimization in terms of remote delivery or pharmacy service. Okay, and then I have example from China as well. So they use electronic information system that is easily accessed by the pharmacist, not only the pharmacist who works in that shelter hospital, but it is accessible for the pharmacist who works at the higher level hospital. So the pharmacist could just like access their systems where the system is supported by cloud platforms and connected with the higher level hospital. So together, so they can work together to just do the medication reconciliation or medication history taking. But uniquely, they use WeChat app to collect the medication information. So the WeChat app is the application I think is very famous in China, just like a WhatsApp we use routinely. So the outcome of this practice is reduce the risk of hospital-acquired infections because patient didn't have to go to the hospital, so they just or the pharmacists did not interact face to face, so they just like fill the form using the WeChat app. So this could be reached by this practice, and then the outcome and other outcome is increase the efficiency of pharmacy services and achieve timely and effective professional medication guidance for patients throughout the entire process. So now here is the example of medication review using telepharmacy. So actually this is the North Dakota telepharmacy project. So to ensure rational medication use, they want to perform medication review by calling in patients to just inform that they will be having a video conference with the pharmacist, and then they made a schedule of this video conference to do the medication review. And then this practice shows that the interview could be just spending about 14 to 20 minutes, but in total approximately 1 hour, together with the evaluation or planning and documentation. And then the pharmacist could identify 1.8 medication-related problems per patient, and then 85% of patients required a pharmacist intervention. So because the pharmacist could identify the problems, and then the pharmacist could have some recommendation to the physician. And then they did some survey. It is mentioned that 77% of responses by survey valued the pharmacist via video. Yeah, okay, so actually it's pretty much the same in China hospital, but they involve the pharmacists in all medical institutions who shall jointly establish and optimize prescription review rules and knowledge database. But again, they use the electronic information system who can be which can be accessed by health care professionals, especially pharmacists from the higher level of hospitals. Okay, next, I have an example as well in US hospitals. So they use remote access to electronic health record and computerized prescribe order entry system and pharmacy information system. So with this service, they can have like 24-hour medication order review. Okay, again in Australia, so in Mount Isa-based hospitals, so they're doing like video conferencing twice a week with the inpatients to just do the medication review. And then the outcome is increased access to a pharmacist, but they listed the drawbacks about this practice because the staff probably just complain about the pressures and unavailability of iPads and difficulties in follow-up the patients. Okay, so we continue with the dispensing. So here is the chart or the process from China hospital. So after the medical orders received by the pharmacist, so hospital pharmacists will review, of course, whether there is an irrational medication or not. If there is an irrational medication, the pharmacist will follow up the prescriber to revise the medical orders. But if it is reasonable, so they will process the prescription, and then they will use intelligent drug storage cabinets and automated dispensers. But for like sterile products, they will utilize some service called pharmacy intravenous admixture services. So after the medication prepared, the pharmacist will double check this remotely, and then the medication will be sent or will be administered to patients. Yeah, so here is the automated dispenser in hospitals. So we don't need any human being here. So the machine just like automatically take the medication out from the cabinet based on the order. So it's just like a computerized order controlled by the pharmacist. So it is really efficient mode of the hospital. Next. Okay, and here is the intelligent drug storage cabinet. So they name intelligent, so it means that they can do much, probably more than a human being. So the intelligent drug storage cabinet store the medication, and then it is automatically record the stock or the number of medications taken. Okay. Yeah, so here is the example from the hospital in Canada. So they use as well the automated storage cabinet. It is amenable to electronic and manual prescription, and then they have 24-hour service for dispensing. Yeah, so how about in Universitas Indonesia Hospital? So I'm so grateful that Universitas Indonesia Hospital has telemedicine service. And then, of course, the telepharmaceutical service will be followed the telemedicine service. So here, pharmacist prepares medicines that are prescribed for patients who use telemedicine service. And then after reviewing and verifying prescription in ECR, pharmacists provide drug information and education related to medication use via telephone call. And then some written drug information together with the schedule, as well as medications, are delivered to patient's home. Yeah. So how about the IV admixture process? Can we use a telepharmacy service as well? Yes, we can use it. So here is the example from US hospital. So they use video imaging and barcode, that is enabled technology to support off-site oncology infusion centers. So in these situations, the pharmacist will be at home, and then the pharmacy technician will be on site the hospital and preparing the or admixturing the chemo or cytostatic, and then to make sure or to ensure the correct drug is selected based on the order. So the pharmacy technician will scan the file, and then the pharmacy remotely check the file. Okay, and then here is the tools that they have. So they have some like camera inside the biological safety cabinet, and then there is monitor outside the biological safety cabinet, of course, and then the monitor can be accessed by the pharmacist remotely to check the pharmacy technician has been done or has been prepared or has prepared the syringe or the vial correctly. Yeah, how about the medication monitoring? Apparently, we can still do the telepharmacist visit to inpatients, to hospitalized patients, even though we're using the telepharmacy service. So here, there's an example of procedures that is used in the hospital about the telepharmacist visit in hospital. So they will connect with the telepharmacist. So if they have any inpatients, they will scan the following documents. So they refers to a pharmacy technician. So because we have the pharmacist at home or outside the hospital. So scan the following documentation and send it to the telepharmacist, and then telepharmacist will review documents and gathers additional information, and telepharmacist will organize convenient time to speak with the patients via telehealth. So they will use like video call, for example, or telephone call, just to make sure that pharmacists could speak with selected patients. And then after they did some interaction with the patient, they gather the information from the patients, they will develop medication action plan, performs medication reviews, and identify medication related problems. And then if they identified any problems, the pharmacists will call doctors or any other health professional, and just to discuss about the problems and to find some solution or some recommendation. Agreed. Okay, next. Yeah, so in China, they use WeChat app as well to do some medication monitoring, but I'm sure that probably they will need some assistance from the nurse to use this WeChat or online pharmaceutical monitoring, because here the example is in the hospital in China where only 3 to 5 pharmacists works in this 1,000 bed hospital. So they involve other pharmacists to access the electronic information system and perform medication monitoring. And the next. Okay, here, what happened in the Universitas Indonesia Hospital. So since we have COVID-19 patient who are admitted or who are located in some red zone, we call it. So the pharmacist still can do the drug therapy monitoring, but using the telephone and the camera or monitor, because the patient could be seen via CCTV. So not only the drug therapy monitoring, we also perform discharge medication counseling. So the mode will be the same. So we use the telephone in green zone, and then we can see whether the patient understand about their medication through the monitor connected with the CCTV. Okay. And then how about follow-up post-discharge patients? Yeah, I think that this practice is quite famous in the US hospital. I'm pretty sure the UK as well perform this kind of practice. So here in US medical centers, there are telephone calls follow-up or follow-up phone call for post-discharge patients. Okay. Next. And how about in Universitas Indonesia Hospital? So again, we try our best to do the follow-up post-discharge patient using the WhatsApp chat or WhatsApp phone call. So here is an example of the way we monitor the patient. So we always provide patient with the schedule or drug information here on the left side. So a patient should be bringing this information for drug information forms filled by the pharmacist, and then we also fill the schedule here. So the patient could just like look this table if they forget. But again, we sometimes, especially for like priority patient, for example, for the tuberculosis patients who should take probably like 3 or 4 medication, and then their compliance is very important. So we follow up the patient through WhatsApp like this. Okay. Next, and then how about the medication adherence? So example from Spain. So they try to make sure or to improve medication adherence of HIV outpatients. So they use teleconsultations using telepharmaceutical care home drug delivery. So this is not only about the service delivering the medication, but they also try to reach the patient and try to remind patient to take their medications. And then the results is amazing. It's quite good because the patients kept virally suppressed and maintain a satisfactory immunological level. And then there is a cost savings in terms of 45%. Okay, and then here is the example of the cloud pharmacy care that China hospital has. So actually they are collaborating with the Beijing hospital, Beijing Pharmaceuticals Association. And then they also developed this cloud pharmacy care together with the college, so pharmacy college there. And then from this cloud pharmacy care, so this is kind of platforms to allow medication consultation as well as health education. So they can use this platform using the pictures, text, or internet calls and identify medication-related issues, both using the group or individual consultations. And then for the health education, they can just provide original articles or reproduce article to be forwarded to patients, so the patient can be deemed, understand, or probably provided with the medication information. Okay. And then here, not only cloud pharmacy care. So in China, they use a multimedia health education to to educate the patient using text, picture, animated cartoon, and video, and then they use the radio station as well. So they use live broadcast or recorded session, about the medication or about the health-related information using TikTok, Blibli, Youku, and YouTube. Next, how about in Universitas Indonesia Hospital? So as best as we can, we provide a drug information service in this hospital. So using the website, so we actively fill the information. For example, here for the fasting or Ramadan, how the patient take the medication during Ramadan. And then here we also have some like Instagram live about how to keep the medication safe. So it is routinely done through the Instagram. And then we also have the free chat column like this. So this is probably passive drug information service, but it means that the patient could contact the pharmacist if they have some questions related to their medication. And then here is the example of telepharmacy practices by practice specialty area. So for anticoagulation area, the pharmacist could have some like telehealth or teleconsultation about the injection technique or about the laboratory test result review, adherence assessment, and adverse effect assessment. So this practice is is performed as well for pain management, and then next, and for the oncology pharmacists. Okay, so even though Dr. Aaron Courtney has been mentioning about the issues or challenges about the telepharmacy, but I tried to collect the challenges faced by the hospital if they would like to perform the telepharmacy services. So here are the issues. The first one is connectivity. So probably this is going to be like issue that patient who stay in the rural or no broadband coverage or no internet, that sometimes we face as well poor broadband coverage. And then the second one is lack of time to implement. So even though, for example, in Universitas Indonesia Hospital, even though we have to provide the telepharmaceutical care, sometimes we have some limited time to contact the patient, but so far we can perform this kind of service. But I know that probably the pressure or the workload will be very challenging for the pharmacists who deliver the telepharmacies. The telepharmacy service. And then the IT skills, I think this issue has been mentioned by the participant about the what skills that pharmacy or pharmacists should have. So yeah, we have some simple mode, for example, like telephone. So I think that all the pharmacists could, most patients could have this kind of skills for just like picking up the phone, or just like contacting the patient by telephone. And then the next one is sometimes patients don't show up for appointments because yeah, probably they have some business, yeah, or they don't have any times, or we just missed or a patient just missed our calls, yeah. So but this is kind of issues that a hospital will face. And then the expensive equipment, we can imagine that the automated dispenser or intelligent storage cabinet are very costly. So this is going to be like issue probably for some hospital, whether they will use this equipment or not. But in Universitas Indonesia Hospital, we don't have this kind of expensive equipment or this kind of intelligent storage cabinet, but probably we can just like pick or choose any other services like follow-up discharge phone calls or any other services that doesn't have to use this expensive equipment. But still, we have to probably have to be utilized with the software or VPN or firewalls. And then the next one is less presence. I think that our moderator has mentioned this kind of issue that pharmacists or patient have, because since we use the telephone or video calls, the face-to-face will not be replaced probably like that, but actually we can have some strategies to overcome this issue. And then the last one is about the reimbursement pharmacists. So until now, probably, I don't know in other countries, but in Indonesia, I'm not sure that reimbursement pharmacists have already approved fee service pricing. Okay. And then how about the future of telepharmacy practices in hospital? So I think that from the example in China hospital, or in the US hospital, they should have some networks between hospitals or probably involving universities and community pharmacies, probably the industries. So I'm sure that in the future, more networks among institutions will be happening. So, and then the more clinical pharmacy service will be delivered. And then probably the telepharmacy practices in the hospital will become standard part of care, not only during the COVID-19 pandemic, but this is kind of option that patients have. And then the more pharmacist roles recognition. And how about the chance or the opportunity that telepharmacy replace the human pharmacist? So I think that this is an issue as well. So there's some worries about the chance that human pharmacists will be replaced because we have some AI, artificial intelligence, and so on. But I think that, so I take the quotes from the article. So despite telepharmacists not being present on site, the human aspect of the pharmacist is still essential for effective care and communication. So please make the human interaction meaningful while doing the telepharmacy service. Okay, I think that's all that I try my best to share about the telepharmacy practices in hospitals. So any questions will be open for it. Just feel free to discuss about this. So I will give the rest of the session to Apoteker Laras.
Okay, thank you very much, Ibu Dr. Apoteker Nadia, for the nice sharing session. So now we will open the question and answer session. We have got some questions here. So maybe for the first opportunity, I would ask Mr. Baharudin Yusuf, raise hand. Okay. So the time is yours.
Wait a minute. Okay. Thank you and good afternoon, everybody, ladies and gentlemen, especially for the speakers, Dr. Aaron and Apoteker Nadia. Nice to meet you. I have some question. The first question is, what do you think about securing patient data in telepharmaceutical process in your country? Because all data in patient will be converted to digital. How to secure that data? First question. Second question is, how has the monitoring of the implementation in telepharmaceutical regulation in your country has been carried out according to the regulation? So many regulation has to prove it to implementation in that country or hospital or drugstore or whatever. Can you explain it? And the third question is, can you explain about how enthusiastic the people in your country are regarding the implementation of telepharmacy? Because in some areas, there are different forms of society. Thank you. My name is Baharudin Yusuf from Palangkaraya, Politeknik Kesehatan, Kementerian Kesehatan Palangkaraya, and see you. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Baharudin Yusuf, for the questions. So there are 3 questions. Maybe Dr. Courtney, would you please to answer first?
Yep, certainly happy to go first, and thank you very much for the questions. I appreciate these indeed. Certainly, you touch on one of the big issues that we have in terms of data security. I think this is universally an issue that healthcare in general has to grapple with quite readily. We have here in the UK, for example, we have taken steps to manage our data security. And I'm by no means a data security expert, but here in Northern Ireland, for example, we do have a series, we have a Centre of Excellence for Data Security and Cybersecurity that work quite closely with government bodies, with the NHS, for example, our National Health Service, to develop strategies and systems and processes that protect. I think one of the key issues in terms of data security has to relate to data capture and management. And really, we need to be mindful about the information that we are gathering and the purpose for which we are gathering that information, because without purpose, you can simply have this mass of data that doesn't necessarily mean anything, but provides a real risk and liability for patients and for themselves, to nefarious hacking, for example, to data breaches. And we have seen here in the UK a number of data breaches happen, and that can cause real impact on patients' day-to-day lives, to companies, to the health systems, to the finance structures that are in place. These are really big issues. So I think you ask a very important question, and I don't think it's going to be a one-hit wonder. I don't think there is a magic bullet per se that can fix everything. I think it's a case of having good training, having good systems, strong processes, good accountability, strong legislation to back that up. So you have a whole package of measures that maintains good practice and the safety of the data. But that's definitely a difficult challenge that I think many countries and many institutions are grappling with. The second point then that you raised, if I may, I think your second question was asking about monitoring and about regulation in the UK, and is this undertaken robustly? I hope I paraphrase that correctly. To a large degree, yes, it does. Now, we are still very much in infancy in terms of the implementation of some of these services. And we have rollout. I know, for example, Nadia there spoke about some of the practices that she has in hospital sectors. Here in Northern Ireland, we have a huge change in our electronic care record system taking place in the NHS. And in Northern Ireland, we're actually transitioning to a new upgraded service, a fully integrated system that will allow us to undertake medicines optimization reviews, reconciliations, validation of prescription, a whole range of things. And that comes with it the additional requirements for data security and all of the different things that come with it. So it is absolutely a challenge, because we haven't set up a specific regulator to focus on data and cybersecurity and those elements. Each of those responsibilities lies within each profession. So we have some differences between how medical staff will treat data security, some differences between pharmacists, between nurses, between physiotherapists, dentists, across the healthcare spectrum. And I think that causes some challenges in and of itself. And what we would need to move towards is a more unified process that people understand what the requirements are, where the responsibility lies, and how those are managed. But currently there are continual audits, even within the university setting. For example, we undertake regular audit and review of even our research practices. Data that we collect during our research processes is all reviewed on a regular basis, and responsibility lies with named individuals that they have responsibility for. Forgive me, the third question, remind me what your third point was.
How the enthusiasm regarding telepharmacy in your country? That's the third question. How enthusiastic people in your country welcoming telepharmacy?
Yes, sorry. So yeah, we very much have, in terms of uptake of these services, we certainly find that there are pockets of the population that prefer to use some of these platform services, some telepharmacy services, rather than the face-to-face community pharmacy, hospital pharmacy sectors that we traditionally have had. But it very much changes across the demographic and the geography of the landscape. So rural, for example, there are positives and negatives in terms of access, not having to travel large distances, not having to take time out of work schedules, for example. A lot of people in our community are still working remotely. I myself work approximately 2 to 3 days a week at home, and then I travel to my university institution for the teaching elements. And, so what we're seeing is there are a huge number of people who are finding that the connectivity, the telehealth, the telepharmacy is a real benefit and allows them flexibility. So they are actually more likely to engage in healthcare. So we see a lot of positives, but there are absolutely large portions of our population who do not use these systems. And so we need to see this, I think, in the short to medium term as an extension of existing services rather than a replacement of services. I think that's probably where we're realistically at. Yeah. Thank you. I hope that addressed your question.
Okay, thank you very much, Dr. Courtney. Maybe from Dr. Nadia. How about if we compare in Indonesia, maybe?
Yeah. Okay. So the first one is about the security. I think that in Indonesia, especially in hospitals, so we already have the data security system. So, for example, in Universitas Indonesia Hospital, so we use the limited access and then the VPN, for example, for accessing the data of the patients. I think pretty much the same, but probably I'm sure that in UK probably has been developing so well. But yeah, we are following them actually at the moment.
Okay, thank you very much, Bu Nadia.
Welcome.
Okay, so maybe we can continue to the next question. Here we have had question from Apotheker Nuke Saswita. Good afternoon, Mr. Aaron. Would like to ask, can telepharmacy be implemented pharmacies to see compliance and the achievement of treatment targets for type 2 diabetes mellitus patients? Thank you.
Okay, absolutely. Thank you very much. Another great question. Short answer, yes. Long answer is we are seeing improvements in this area. So at the moment here in Northern Ireland, we have a range of clinics that run week by week, both with medical staff, with integrated care, mixed models of provision of care. I mentioned, for example, the antenatal care for pregnant women, for example. They will attend for screenings, they will attend for scans, but they will also attend a number of online consultations and telecommunications with their pharmacists, with their midwives, with a whole range of healthcare staff. So yes, this absolutely is happening. And I can think of at least one clinic that I know that runs in Belfast, which is Northern Ireland's capital city, where there is a diabetes clinic that runs where they're doing monitoring and management. So you will have regular contact with your patient and maybe say, for example, a biannual visit. One of those visits, for example, could be through one of these platforms, an online consultation process. We haven't seen this specifically in a community pharmacy setting. That's very much more in a hospital setting, driven where you have the care of the medical staff, the nursing staff, the pharmacy staff, all working collaboratively together. However, I do know of a number of small independent pharmacies who have implemented similar services for cardiovascular health. So maybe not specifically for type 2 diabetes, but yes, certainly for health conditions, we're starting to see these remote access and telecommunications processes being brought on board, and ultimately allows for monitoring, check-in, making sure a patient doesn't have any questions about their medicines, making sure they're happy with the regimen that they're supposed to be taking, if there are any medicines optimization issues that can be addressed, or perhaps even prompting a face-to-face consultation as a follow-up. You know, that is a very strong way to triage. So yes, that absolutely happens at the moment. And I can think of one diabetic clinic that does happen in Belfast. But as I said, it's more across a spread. We would see asthma clinics, for example. We would see cardiovascular clinics, a whole range.
Okay, thank you very much, Dr. Courtney. Okay, the next question is for Bu Nadia. Dear Bu Nadia, would like to ask, Could you share or recommend what will be do and don't during telepharmacy? Do you think it is needed for recording the telepharmacy done to the patient? Thank you.
Okay.
From Carlina.
From Carolina. Yeah. So actually, it has been mentioned as well by the Ibu Dita shortly about we cannot make the difference between the telepharmacy and then the face-to-face pharmaceutical service here. So it means that even though we know this is not the face-to-face interaction between pharmacists and the patients, but we have to interact patient as if we are there. So I think that this is the tips for the make the interaction human being meaningful, like I said before. So so please don't limit the service that you can give to the patient. So even though through teleconference or through the video call, we have to gather, or we have to provide the service as good as we provide service without this kind of media. Yeah, and then the second one, yes, about the issue during the telepharmacy, sometimes we need think about the confidentiality of the data of the patients. So while we're doing the chat, or we just talk with the patients, we usually don't do the recording to the patients. Yeah, so here is so that is one of the way to protect patients' data, so to ensure the confidentiality. So but I think that we can just like make some notes while we're talking with the patients, and then this notes will be documented in the electronic care record. Yeah, I think that all the how we communicate with the patient, we need to make the patient as human being. Even though this is like a conference, we just don't distract with another activities. So just do as if you are there. So the patient will be feeling like, okay, so the pharmacist will give the full attention for me. I think that is one of the way to deliver the good telepharmacy service. Probably Aaron can have some additional answers. Go ahead.
No, Nadia, I think you're absolutely on the mark there. You know, one of the things that I have noticed from my time working in community pharmacy is that the number of recommendations, the number of pieces of advice, the product recommendations that you make as a community pharmacist, and here in the UK, a lot of those decision-making processes aren't formally written down. They're not documented. Whereas when you go to a hospital setting or to a clinic setting, you very much find that patient interactions, consultations, everything is meticulously documented in the patient notes. Yeah. And this is where I think there is a bit of a difference in terms of whether you're in primary care settings or whether you're in secondary care settings. And I think this is something that we as a profession of pharmacy, particularly in the UK, we really need to break through those barriers and ensure that when patients are when decisions are being made about patient care, that those decision-making processes are documented accordingly. Yeah. So similarly, we wouldn't record a teleconference or a telecall, for example, telepharmacy communication with the patient. But what we would be expecting the healthcare professional to do is make appropriate clinical notes to back up that interaction. Yeah. And again, it's interesting that we see now that community pharmacists are playing such a good role in managing services and skills. But where we're definitely behind on that in the community pharmacy sector is the maintaining of patient care records and notes. Now, we have an additional issue in Northern Ireland that access to the electronic care record is not available in the community setting, whereas it is available in the hospital setting and in the GP practice setting. So as a community pharmacist, you are left out a little bit in terms of the patient background and detail, and that proposes its own challenges as such. But Nadia, I think you're absolutely right. It's about making those interactions meaningful with your patient, treating your patient as a human being. And if there is anything clinically relevant, that is then documented accordingly. Absolutely.
Thank you very much, Alan. Probably I will add some one point as well. So we can use the tab of hospital. So we don't do the telephone using our numbers because something could happen with our phone. So usually we use the tab, or we use the number of pharmacy in our hospital. So all the data, if it is supposed to be recorded, it will be recorded in the hospital's phone. So, and then the phone will be only in the hospital. No one will carry the phone out of the hospital. I think that is one of the solution as well.
Okay, thank you very much, Dr. Nadia and Dr. Courtney. And this is maybe the last question. Dear Dr. Aaron, I am Lucy. How the pharmacists, especially in community, provide the information about medication history of the patient, history of patient illness, if the patient wants to consult about his or her medication issue? Thank you.
So yeah, currently what we would do is this provision of advice and guidance is something that community pharmacists do face-to-face quite regularly. We have here in Northern Ireland a mix of both independent community pharmacies and also larger chains, multiple pharmacies, so the likes of Boots and Gordon's. We also have then the independents, so community pharmacies where they are one person owns one facility and that's it. So each of those settings, there are payments that come through from the business services organization, which is it's like the purse strings of the government sector that pay and remunerate. So pharmacies do get a fee for providing services to their patients as a flat rate. So as part of that, pharmacies are then expected to provide medicines optimization, medicines reconciliation style processes to the patient free at the point of use. So all patients can ring into their local pharmacy at any stage and ask to speak to a pharmacist and can talk to them about any medicines issues that they have, and the pharmacist can then undertake a full medicines optimization review. Now, the pharmacist in some instances will choose to schedule that, to book in an appointment, and that can obviously then be whether it's a face-to-face call or whether it's an online or a telecommunications process. And that is usually organized at the discretion of patient preference. So usually you would find that the pharmacist will book out a portion of their time during the day. If it's a particularly busy pharmacy, you sometimes find that multiple pharmacists will be employed, one or two to look after the dispensary or the shop floor, and then one to provide these pharmaceutical services. And that is reflected in some of the payment structures. At the moment, pharmacists are remunerated for their skills and services, as well as for their dispensing. So the government is trying to move away from simply paying pharmacists to be dispensing factories to simply just churn out medicines, and instead to shift to a more services-based provision. That is a slow change that has happened over this last 15 years. And I don't think we're fully there yet, but I think we are making good progress along that line. So I hope that helps address the question. But if not, please let me know.
Okay, thank you very much, Dr. Courtney. Maybe Bu Nadia want to add some?
Probably you can remind the question, Laras.
So about the medication history taking.
Medication history taking.
Yes. Medication history of the patient and also history of patient illness. How to do that using telepharmacy?
In the community pharmacy or in hospital?
She asked in community pharmacy, but maybe Ibu Nadia can add some. How about in the hospital pharmacy?
Yeah, I think I have already mentioned about the medication history taking and reconciliation in my slides. So actually for telepharmacy services, we can do this kind of activities using probably teleconference or just like video call, just to make sure that the patient mentioned all the medication has been taken or all the history of illness. So actually this practice could be done as long as we can dig or we can explore the information from the patient very well. But I'm pretty sure, I don't know in community pharmacy, because from my experience working in community pharmacy, we have some limitation for history of illness from any other hospital or probably primary care. So we only have the information from interviews from the patients, because unlikely or I don't know, unfortunately in Indonesia we don't have any connected information from the community pharmacy and to GPs or to hospitals. So it is like independent information that we have in our single community pharmacy. So the how we explore this kind of information with patient is going to be like crucial process for the medication history taking.
Yeah, Nadia, if I can just jump back in and say, yeah, we're absolutely in a similar position here in the UK, and that's really? one of our problems is that the community pharmacist is very much isolated from the wider healthcare network. And that is fundamentally, it brings us back around to the very first question that we were asked about data security. And it is fundamentally because at the moment, because we have a National Health Service, if you are working as an employee of the National Health Service, you will be granted access to certain levels of data based on your role. However, to expand that out to private companies, independent contractors, independent community pharmacies, for example, that then leads to conflict in terms of how you manage that data security. So at the moment, our community pharmacies sit separate. So any medicines history taking that they are doing has to be so comprehensive because they don't have access to the electronic care records that everyone else has. Now, interestingly, we have our third sector in Northern Ireland and the UK, which is growing vastly over this last 5 years. We have in every GP practice, we have a pharmacist who is based in that practice, and they have access to all of the electronic care records because the GP practices sit under the NHS and have funding through that structure. So we are able, in many cases, we have good relationships, professional working relationship, nothing formal, but working relationships between local community pharmacies and local GP practices, so that the community pharmacists can almost act as a signpost, as a gateway, that if patients report something of concern, then the community pharmacist can forward that on to the likes of a GP practice, where the GP practice pharmacist can then maybe book in or schedule a telecommunication call, for example. So at the moment, it's not a perfect system, but it sounds something similar to what you're describing, Nadia. And I just think it's interesting that the two countries have similar issues and challenges. Yeah, absolutely.
Okay, thank you very much, Dr. Courtney, and also Dr. Nadia, for sharing your expertise in the session. So this is very interesting discussion, I think. But anyway, because the time is up, so before ending this session, we would like to ask you to stay for a moment, because we would like to present a token of appreciation. So kindly be invited the coordinator of continuing pharmacy education, Kartika Citra, Master of Science and Apotheker, to give the token of appreciation. So the first certificate will be given to Dr. Aaron Courtney as our honorable speaker today. So Dr. Aaron Courtney and Apotheker Kartika Citra, please give your best smile for the photo session. Okay.
Thank you, Dr. Aaron. We greatly appreciate for your time this afternoon. Looking forward for another project later. Thank you.
Okay, thank you. 3, 2, 1, cheese. Okay, thank you very much, Dr. Courtney. Okay, and the second certificate will be given to Dr. Apoteker Nadia Farhana Syafhan. To Dr. Nadia and Apoteker Kartika, please give your best smile for the photo session. 3, 2, 1, cheese. Okay.
Thank you so much, Dr. Nadia, for your presentation.
My pleasure, Citra.
Okay, and also for the last photo session, maybe for all of the audiences, please cam on your camera in your Zoom because we will take the last photo session together with the speakers. Okay, the committee can take photo. 3, 2, 1, cheese. Okay. Thank you very much for all of the participants and also the speakers for this session. In a brief, we can conclude from this webinar series, Future of Telepharmacy and its opportunity is actually the COVID-19 pandemic makes the urgencies of using technology to provide pharmaceutical services. Delivery pharmaceutical care can be given through CCTV or telephone, online camera, or online chat. There are some applications that can be used for the telepharmacy. For example, in medication selection, in medical review, automatic dispensing system, patient counseling and monitoring, and also provision clinical service, and also for the IV admission process or for follow up the post-discharge patient. There are also some challenges that must be overcome by the pharmacy. For example, like the implementation, the infrastructure personnel, training, time resource, patient education to use, about the data and security management, lack of regulation, and also some human interaction. So actually, pharmacists must have innovation to overcome the challenge of telepharmacy. So the telepharmacy can be used for the future. Okay, thank you very much, ladies and gentlemen. We have come to the end of our discussion today. Future of telepharmacy and its opportunity. Before we end our webinar today, I will remind some important things. The first, after the closing, all of the participants need to fill the evaluation form for the webinar series that will be provided by the committee. Second, besides that, after the closing, for all of the participants, please do not forget to take the quiz for the post-test. This quiz will be multiple attempted as a requirement to get SKP credits from Ikatan Apoteker Indonesia. The electronic certificate later will be given for the participants who finish the post-test with minimum score 80% and also join the webinar via Zoom. The post-test will be open for 1 hour only after the webinar. The electronic certificate also will be given around 1 week after this event through the email. So I think this is the end of our webinar today. On behalf of all of the committee members, I would like to express my utmost gratitude to all the distinguished guest speakers and also the participants for making this event success. And also apologize for all of the mistakes or obstacles during the webinar. Thank you very much and have a nice day. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon. Thank you.
Thank you very much indeed, Aaron.
Thank you very much.
Thank you, Laras.
Thank you very much, everyone.
Participants.
Thank you. Take
Very
care.
much, Bu Nadia. Take care.